Okay, so let's use a case here where we can think of these systems that are being activated. Okay, so because always ask yourself, like, why are these systems being triggered? Like, what's the purpose of these systems in the setting of volume loss? So if we're talking about someone who's severely dehydrated after having run a marathon, or someone who's been in a car accident and their blood pressure is extremely low because they're hemorrhaging, or someone who's been in a house fire and they've had severe burns and they're losing tremendous amounts of fluid in the burns. Those are all scenarios of low plasma volume. Okay, and this turns on systems because the body wants to maintain blood pressure, right? Very important to maintain its blood pressure so that it can feed its organs, such as the brain, the heart, the lungs, the kidneys. And with continuation of low blood pressure or hypotension, those organs will start to become ischemic, right? So the body is very particular in terms of controlling normal blood pressure as much as it can, okay? So what's going to be turned on in the setting of low blood pressure? Well, the renin-angiotensin system is going to be turned on, and angiotensin 2 is going to activate or secrete aldosterone from the adrenal glands. Well, that's going to help reabsorb salt and water and try and improve the plasma volume. The sympathetic nervous system is going to be activated. So the sympathetic nervous system is sensing this dropping blood pressure, and it's going to send signals to the body to try and raise the blood pressure. How's it going to do that? Well, the sympathetic system goes to the heart, and it stimulates the heart to beat faster and stimulates the heart to beat harder, increased contractility. It goes to the blood vessels, and it leads to vasoconstriction of the arteries. Okay, so all those little arterioles are now being vasoconstricted to try and maintain blood pressure. So if you tighten all the arterioles and make them much smaller, less blood can flow through them, and it'll maintain systemic blood pressure. Okay. What else is going to happen? Well, ADH is going to be released because the kidneys are sensing the low blood volume, which is going to result in aldosterone secretion. But the brain is also going to sense this low blood pressure and activate and release ADH. So ADH is released in settings of high concentration of salt, since it wants to dilute it, but it's also released in low blood pressure states to reabsorb as much fluid as possible to maintain the blood pressure. Okay, so all these systems are turning on in the setting of hypotension. Okay, because the body knows that with a low blood pressure, organs are going to suffer. Okay, so let's talk about volume loss. Okay, so let's move on and talk about edema. And edema is really increased tissue fluid, right? So it's fluid that's left the intravascular space, and it is now in the interstitial space, causing swelling of the interstitial space. So what can lead to edema? Well, the first one is if you have a very high hydrostatic pressure coming in on the arterial side. So say you have a extremely elevated blood pressure, 250 on 150, just an example. The hydrostatic pressure at the capillaries is going to be very high. So that's going to force more fluid into the interstitial space and lead to tissue edema. That's a pretty unusual scenario. You can have that occur in your brain, say in a hypertensive crisis, where your blood pressure is so high that you're now developing severe headaches, vomiting, potentially decreased loss of consciousness, because there's so much arterial blood pressure that there's more fluid leaking into the interstitial space, okay, causing edema. Okay, what's another possibility? What if the venous side, so it goes from the arterial side to the capillaries to the venous side, what if the venous side had higher pressures in them? And it didn't allow the fluid to be reabsorbed by the veins from the oncotic pressure, because the venous pressure was still high. So what about someone with a blood clot in their vein of their leg? Okay, well, that leads to a swollen leg. That leads to edema of the leg. And the blood clot that's in the vein, so a deep venous thrombosis, is causing back pressure in the veins, and it's increasing the venous hydrostatic pressure. So it is not allowing the fluid to be reabsorbed into the capillaries, and you get edema. Okay. What about if someone's very, very obese and they have edema of their legs? Well, that can happen for the same reasons. The veins get compressed behind the knees, at the groin, when you're very obese, and that backs up venous pressure and leads to leg edema. Okay, so too much arterial pressure or too much back pressure from the venous side is going to lead to more tissue edema. What if you have reduced oncotic pressure? So you don't make enough albumin in your liver because your liver is diseased, say with hepatitis or cirrhosis, and your oncotic pressure is much lower because your circulating albumin is low. Well, that's going to result in more fluid staying in the tissues, right? The hydrostatic pressure is just fine, but the ability for the veins to bring back the fluid into the capillaries is lacking if your albumin is low, and you'll have edema all over your body, okay? In particular, in your legs because of gravity. What if your capillaries are just more leaky? They just leak more. Well, that would be in the setting of, say, a burn or anything that's creating inflammation, right? Capillaries become very leaky when there's inflammation because of the histamine release from the mast cells. They vasodilate and they become very permeable, allowing fluid to go into the tissue. What if you have blockage of the lymphatics or the lymph vessels? So the lymphatics is this system of ducts and lymph nodes that remove waste from the tissue that the capillaries didn't reabsorb. And they also remove fluid that didn't quite get back into the capillaries from the oncotic pressure. Okay, so you produce lymph fluid, and the lymph fluid collects in these lymph ducts, goes through lymph nodes, and finally drains back in to the venous side, or the central circulation. Okay, so the lymphatics are responsible for basically cleaning up the extra waste that the capillaries didn't take away, and the extra fluid that the capillaries didn't take away. So if you have blockage of your lymph vessels, say from a cancer or other diseases of the lymphatics, you're going to get tissue edema because they're partly responsible for removing the fluid from the tissue. Okay, so if you have local edema, always think of inflammation. So swelling on your arm, maybe that's from an insect bite, or maybe it's from a local infection on the arm itself, right? When we're thinking of generalized edema, meaning swelling in both legs, then we start to think of more organs that are starting to fail. So which organ failure will lead to edema? Well, if you have congestive heart failure, okay, so your heart isn't able to pump very strongly. Well, if your heart's unable to pump very well, it can't pump blood to the lungs on the right side of the heart, and it can't pump blood out into the aorta on the left side of the heart. So you're going to get backup of blood into the venous system, okay? And you're going to get higher pressures in the veins that are trying to return blood to the heart, and that's going to result in leg swelling. It's going to result in general fluid overload in all the veins of the body. And you're going to have distended neck veins, which we call, well, the jugular veins in your neck, because the blood that's in the jugular veins can't return to the heart very well anymore, because the right side of the heart is unable to pump properly to the lungs. So there's fluid backup, there's blood backup, okay? What about just dependent edema from sitting too long? So say you're on an airplane and you're sitting for 10 hours. Well, your veins have valves in them in your legs, and they rely on muscle contractions to move blood up the veins and back to the heart. So if you're sitting for long periods of time, you're not only at risk for getting a deep vein thrombosis, a DVT, but you're likely going to get some edema in the tissues just because the veins couldn't move the blood up the leg very well. So basically anything that increases the vascular volume, okay, can lead to a tissue edema. What about decreased oncotic pressure, right? So that comes back to albumin. So if your liver is diseased, well, that's where you make albumin. If you have low albumin, you're going to have poor oncotic pressure or lower oncotic pressure. That's going to lead to tissue edema. If you have kidney disease, where you're spilling tremendous amounts of protein into your urine, so you're losing your albumin, that's going to result in the same concept, that you're losing albumin, and so you have tissue edema all over your body from the low oncotic pressure. And the last one, say if you have an overwhelming infection in your bloodstream that we call sepsis. So in sepsis, you have bacteria in your bloodstream, you have tremendous amounts of inflammation to try and fight this infection, typically of bacteria, and the capillaries become very leaky all over the body. And when the capillaries become leaky, the fluid leaves the intravascular space and you get edema. Okay, so I think of 3 organs in particular when somebody has a lot of generalized edema in their legs or in their hands. I think of the heart, I think of the kidneys, and I think of the liver. Okay, and here's a nice slide just bringing things together a bit. So decreased oncotic pressure from, say, liver disease or kidney disease where you're leaking albumin into your urine because of some glomerular disease that's allowing albumin to get into the nephron tubules and then finally into the urine. So you have proteinuria. You're losing your oncotic pressure. Increased capillary permeability. That's typically in the setting of inflammation or sepsis. Or say you have massive burns around your body and there's tremendous inflammation. Your blood vessels are leaky. Increased hydrostatic pressure. So if you have increased hydrostatic pressure in your veins, say from back up from your heart, right? So when the heart's not pumping, the blood backs up in the veins. So that's going to increase the hydrostatic pressure in the veins and not allow fluid to be reabsorbed into the blood vessels. Or on the other side, if you have increased hydrostatic pressure on the arterial side of the capillaries, because your blood pressure is extremely elevated, that can lead to tissue edema. And finally, lymph obstruction, where the extra tissue fluid cannot be taken away by the lymph vessels because they're diseased or obstructed, and that's going to lead to edema as well. Okay, so let's make some sense of this next slide. We're talking about edema in the middle. Okay, and let's just look at that word. So edema means you've got fluid that's not being cleared from your interstitial fluid, and you've got swollen legs or swollen tissue of your face or your hands or in your lungs. You could have pulmonary edema. So you could have it anywhere in the body. Just for there's something that's happening that's making you leak fluid and not get it back into the vascular system. Okay, so on the left of the slide, it says decreased production of plasma proteins. We've already spoken about that. That's where you have liver failure. So there's the liver part. Okay, you've lost your oncotic pressure. You're not reabsorbing the fluid back into the venous capillaries, the venous side. Okay, so think of the top left as I've got liver failure, or what else could it be that I have low oncotic pressure? Well, I could have, I'm losing my albumin, so I'm making it in the liver, but the kidneys are just leaking it out because of a diseased kidney or a failing kidney, where the albumin or the protein is just going through the glomerulus, and you again have low oncotic pressure and you get edema. So there's liver and kidney on the left side. What about on the lymphatic side? So on the other side, it says something is wrong with your lymphatic system. Okay, well, if there's something wrong with your lymphatic system, it's not doing the final cleanup of fluid, anything else that was left in the interstitial fluid that it can absorb and get it back into the venous system through the lymphatics. So we have this lovely system of lymph nodes and little tubules all through our body. I would highly recommend you just look at a general, just a picture of lymphatic system. And this is what does the final reabsorption to make sure that we don't get edema in our interstitial fluid. So any disease of the lymph system will cause you to have edema. What about, so liver and kidney, top left, we spoke about lymph obstruction here. What about increased hydrostatic pressure? So anything that's going to cause back pressure in the veins is going to keep the hydrostatic pressure high
when it should be getting gradually lower as it goes across from across the capillary. So heart failure, which is backup of fluid from the heart on the venous side, would keep the venous hydrostatic pressure high, and the fluid just can't get back into the blood vessels. So heart failure is by far the most common one. Venous obstruction, that can just be what we spoke about before, so obesity or kinking of veins in your legs that is not allowing normal flow of blood to in the venous system can cause venous obstruction. So bottom left would be an example, would be heart failure as increased venous capillary hydrostatic pressure.